And we're back with Money Talk. So glad you could be with us. We wanted to bring something to you that you've heard it in the news all around the state, and that's been what they've called the controversy over the new hospital for New Orleans, the LSU Medical Center, to replace the old charity hospital. But before we get into all that, it is my esteemed honor, for those of you who have not met him, for you to meet the actual gentleman who is in charge of all of the doctors and the people who are working on our bodies and keeping us feeling good, and that's our Chancellor, Chancellor Larry Hollier. Good to see you.
Thank you. Very good to be here.
Glad you could be on the show. And he and I have some significant ties because we, I came from Lafayette to New Orleans, and some 10 years ago, when you were like 15, you came from Crowley.
A long time ago, right?
Tell us a little bit about you, Doc, so our audience can feel comfortable with you.
Well, as you mentioned, I'm from Louisiana. Trained at LSU and LSU Medical School. Did my surgical training at Charity Hospital in New Orleans. Spent 2 years in the Air Force. Went away and did an additional training in vascular surgery. Started the vascular surgery division at LSU here, and then was recruited by Mayo Clinic and went and started the division of vascular surgery at Mayo. Started their residency program, research program, and so forth. Got recruited back to Louisiana as head of surgery at Ochsner. Then got recruited by Harvard to develop a new U.S. academic medical center in Europe. After that, I was recruited to Mount Sinai Hospital. Should have turned this off.
There's nothing wrong with that. That means that you're on call. And when the doc's on call, the doc's on call. That's fine.
I was recruited by Mayo Clinic and then Ochsner Clinic. After that, Harvard recruited me to help develop a new academic medical center in Europe. From there, I was recruited to Mount Sinai Hospital in New York as head of surgery, and then subsequently became president and chief operating officer of the hospital as they underwent some financial turnaround. Then came back here as dean. After the hurricane, was also appointed chancellor.
So you're no new kid at the rodeo, I can tell you that. You've been around a little bit.
I think the good part is that I've had the advantage of seeing healthcare delivered under many different systems.
Yes.
And the one thing that is very evident to me is that while Louisiana takes good care of its citizens who are uninsured and underinsured, it has not been a financially viable model over time. And we're facing now an opportunity to really change how healthcare is delivered and change the financial background of this. A new academic medical center that has enough capacity to take care of not only the uninsured, but also many of the private patients that we currently take care of in many hospitals across the city. What we'd like to have is this new academic university hospital become a destination hospital, much like you see in Houston or like you see at University of Alabama in Birmingham.
Sure.
Those are destination hospitals where people from outside this region come for care because they recognize that it is some of the best in care with the latest of techniques and the latest instrumentation. That's what we'd like to see here, so we can train the kids that go out and practice in our state with the latest technology.
And that's so important because having a hospital like that also helps keep them here in Louisiana. So we're using our local talent.
That's correct. You know, historically, our kids have pretty much liked to stay and practice in Louisiana. In fact, of the physicians practicing in Louisiana today, 70% of them trained in an LSU facility. Wow. We'd like to continue that type of progress.
Yeah. Let's talk about what it's been the pros and cons of the old charity compared to a new hospital, and I sit on the not-for-profit foundation board of the LSU Medical Center, but tell us about why the better decision from your standpoint for a new hospital rather than trying to revamp the old one.
Well, first of all, Charity in its day was an outstanding facility. Patients came from far and wide to get their care here. As time went on, financing of the hospital sort of did not keep up with the financing needs of all hospitals for new equipment and everything else. So it's well past its time. To try and build a new state-of-the-art hospital in the old facility is just not realistic.
We're gonna stop right there because we're gonna take a quick commercial break, and we come back. That's a good way to tease our audience to make sure they come back when we say it's not realistic. So we're gonna take a quick break, Doc, and when we come back, we're gonna get more into the details of what Chancellor Hollier is talking about in terms of the pros and cons with the old charity hospital compared to the proposed new one. Stay with us. More Money Talk is coming your way, so don't move. And we're back with Money Talks, talking with the Chancellor at the LSU Medical Science Center, Medical Sciences. How do we say your title, Doc?
I'm Chancellor of the LSU Health Sciences Center.
Okay. It's a very, very small title. But we're talking about the differences from the opinion of the old charity compared to the new. And you were getting into why the consensus is from the hospital standpoint that this needs to be a new facility.
Well, the old facility, while it was good in its time, is really very antiquated. Even if you were to gut the hospital, the old charity hospital, and build another hospital in it, you could certainly build a hospital there. Mm-hmm. But you're not able to build the state-of-the-art facility that we're talking about building here. It doesn't have capacity for the clinics that need to take place. It doesn't have parking capacity. And the whole system, just the way it's designed right now, would not meet many of the code specifications. That's not to say it couldn't be a hospital, but it's not going to be adequate to build a destination hospital in a true academic sense as we want to build this.
And we want to do that because we want to become the destination hospital in Louisiana like these other places are.
Again, this is what allows a facility to be financially self-sustaining. Mm-hmm. So it's a different model from what we used to have. At the present time and in the past before Katrina, recognized that only about 5% of the patients in the charity hospital had Medicare. Hmm. If you're not getting much Medicare, you're not getting a lot of Blue Cross and Aetna mm-hmm. and other facilities.
Mm-hmm.
So there was very little commercial insurance there. That means the state was using state health care dollars of the disproportionate share funds and Medicaid funds to really underwrite the running of the hospital. Yeah. If you have a hospital that is attractive enough to bring in insured patients as well, particularly those coming from distance, then you have something that is financially viable on its own 2 feet. Right. So that's what we're trying to do here.
Okay. Of course, the controversy over how many beds, that the big number of 424, that are too many beds or whatever. What's the take on that?
Well, that's a very good question. Mm-hmm. Remember that before Katrina hit, the charity hospital here in New Orleans had 550 beds and were filled. Even with the change in the population that has taken place, multiple consultants have looked at this and have recognized that to build an academic medical center, you need much more than the 275 beds that we have today. Currently, the interim LSU hospital has 275 beds. We cannot get cases in that we need to get in. We're backlogged for several months in patients waiting for surgery to come in. So we know that when we open the hospital, unless we have adequate capacity, we won't be able to take care of insured patients as well as the others. If you build a small hospital, you're recreating the charity system, mm-hmm. and financially it's not viable. We need to have enough beds to bring in all of the uninsured that we recognize we would get,
sure.
a significant portion of the Medicaid patients that we also care for, and also bring in our private patients. Yeah. We have a significant number there. Our faculty practice today sees over 110,000 office visits of insured patients. We'd like to be putting that into the university hospital where we can actually have our teams work together, have a true multidisciplinary group practice like this, and provide the highest quality care.
Yeah. Got to get into another question that people have been throwing around out there saying that this hospital will need a subsidy. Is that a misconception?
It's a grave misconception. Recognize that the state has an obligation to pay for care of those who have no insurance, mm-hmm. and the state also has to pay for prisoner care. Federal government does not let you use disproportionate share dollars or Medicaid dollars to take care of prisoners. It comes from state general funds. So there is no subsidy that is taking place. Right now, the state is spending over $70 million a year in state general funds to pay for the care that is given to prisoners and some of the uninsured. That doesn't change because you have another hospital. They still have to pay for that care. It's not a subsidy, it's payment for care that is delivered.
And what I want to think about when we say about that money's, that we're paying for that now, even with the small hospital we presently have.
Paying for that now, and you will be paying for it in the future. Even if you had no hospital here, somebody's going to have to provide that care, and the state has to pay for it.
Very quickly, this is September. When are we looking at possibly seeing this new hospital begin to take forward?
Well, as you know, the land has been acquired and is starting to be cleared. The business plan of the new hospital will be presented to the Joint Committee on the Budget about the middle of September sometime.
Okay.
And I think that would be sort of the deciding factor. If that is approved at that time, then you would see pilings going in the ground before the end of the year.
Okay. Well, we're going to let you get back because you're being buzzed, and we appreciate you coming. And we'll have you back once all this is settled and see what happens, okay?
Thank you very much.
All right.
Happy to be here.
Thank you, Chancellor.